So metastatic breast cancer, like diabetes, lupus, heart disease, is starting to become more of a chronic disease, at least certain types of metastatic breast cancer. I don't know if we're there for cure yet, but we certainly are able to control the disease for much longer, and we're talking in terms of years and not months. So when we give a diagnosis of metastatic breast cancer to a patient, it typically means that's a disease that's not curable, but treatable for prolonged periods of time for a lot of patients. Women, compared to a couple of decades ago, women with metastatic breast cancer are living longer and better quality of life. For certain types of metastatic breast cancer, women are living 4 to 5 years with the disease, with treatments that are easy to tolerate and allow them to maintain a good quality of life and still do things that they enjoy in life. Over the last decade, we have several new drugs that have made it to clinics and are available to patients that are very effective for treatment of metastatic breast cancer, for controlling the disease, for preventing progression of disease, for controlling the symptoms. Most of these drugs are in the area of anti-hormone therapy, anti-HER2 therapy. Few new chemotherapies have made it into the clinic. And currently, a lot of research is undergoing to study new drugs and new targets to treat metastatic breast cancer, not as a whole, but as individual groups. That's what we call personalized medicine. Identify tumors that have specific aberrations or abnormalities and study them with appropriate drugs. At University of Kansas, we're actually conducting 2 of these trials that are looking at novel drugs for patients with metastatic breast cancer. It's not just the genetic code in a person, but to say genetic code in the tumor or certain proteins, markers that are overexpressed or underexpressed in certain tumors that allow us to develop drugs to target the specific cancers.